I'm Deborah Patt. I'm a medical oncologist and an executive vice president of Texas Oncology in Austin, Texas. Welcome to Medscape Oncology Insights. Joining me today is Dr. Brad Hirsch, a medical oncologist at Texas Oncology. Thanks for joining me today, Brad.
Thanks for having me.
So let's talk a little bit about second opinions. Tell me what happens, or have you ever incurred a second opinion where you disagree with the medical recommendation of another doctor?
Absolutely. As a matter of fact, a few weeks ago, I had a patient who had three opinions at the end of the day. He'd gone to California, he'd gone to another center in Texas, and he came back to me, and he was incredibly confused. And I think that the best thing you can do under the circumstances is just sit down and logic through it and try to show where the evidence exists and really just help them understand how to reconcile all the different things that they've heard. And at the end of the day, you have to listen to what they've found and what they feel to be the right path and try to support them through that.
I think it's a great recommendation. I have to say, as a physician, I often see my major role as an educator to our patients. And so educating them on what are reasonable medical decisions is really important, and how to sort through those disparate recommendations if there are some. It's important too, because sometimes they may receive recommendations that you feel are not appropriate for the patient. And I think it's important to know that as we have obligations to patients, of course, first to do no harm, and then to help them as we can, that it's not our obligation as physicians to follow someone else's recipe of treatment if we feel like it's not appropriate for patients.
I agree. And it puts the patient in an incredibly difficult circumstance if one of the doctors says they're not going to treat somebody unless they follow their specific recommendation. And so it's just reconciling it all and landing in a good place.
That's right. Do you have any pearls of wisdom when in guiding patients through a second opinion discussion?
Sure. I always try to figure out what their goal is with it. I try to understand why is it that they want a second opinion, and I think that guides where they go. If they're looking for a clinical trial opportunity, maybe that's something that might not be available in other places. Are they just looking to get more advice about what opportunities are out there? And we help to guide what we can do as a practice and what I can do as a physician versus making sure they get to the right place. And I think I also try to guide them of, where are the places where they're not going to have to go through another 100 tests unless they're important to do, and where I really believe that they have an expertise that we can all work together to improve their care.
I couldn't agree with you more. I talk with patients very openly about seeking a second opinion. And while I think that it's not necessary, it can sometimes be helpful. I feel like it's important to have those discussions transparently with your patients, because it does build trust. And I feel like we have the opportunity to guide our patients around second opinions by giving them some advice. I feel like people seek second opinions for a couple of clear reasons, which you articulated. I think sometimes there are deficiencies in health literacy. I think sometimes there are questions about medical decision-making or access to clinical trials. And I think sometimes there may just not be an optimal fit with the person who's told them they have cancer for the first time that leads them to seek another opinion and make sure that they're on the right track. And so I think it's useful to understand sometimes what patients seek from a second opinion, so as their doctor, you can help guide them in the right way. I'd read a study regarding health literacy that shows that patients leave the room with about 20% of what their doctors tell them. And I certainly feel that as you tell patients they have a new cancer diagnosis and you feel like they leave the room like a deer in the headlights. I feel like we try to do things to make that better by giving patients treatment care plans. I often invite patients to have a spouse or other caregiver in the room with them. I give them something written when they leave the room. I let them record me if they want to try to improve their health literacy so they can see that again. I also have my nurse call them the next day. But still, sometimes hearing it from another doctor can improve their health literacy and let them make more logic-based treatment decisions, which I find helpful.
I totally agree. And I think that there's a misconception that if you're going to get a second opinion, it means you're going to travel to an academic medical center in another part of the state or even a different state. And I think often, it's just a second opinion where they can go down the road to another doc within community medicine or academic medicine that can really give them a new insight and new opportunities. So I think it's really understanding what they're looking for in that process.
I think that's true. And I will say sometimes people seek a second opinion in distant locations. Maybe they travel to go to a major cancer center or somewhere else. Maybe that's because of availability of a clinical trial that we don't happen to have open at our site. Maybe it's because they just want to see someone in particular. And when we can guide them around that, it's helpful, because to your point, there's some keys that they need to understand. The first, they don't need to repeat this expensive testing that they've already had done. It's completely unnecessary if you've had a CAT scan to have a CAT scan repeated. If you've had labs to have labs repeated. If you've had a biopsy to have biopsies repeated. That's unnecessary spend of money. And then it's also important to have transparency, I think, with your patients. When they have a treatment plan recommended to them, to come back, because most patients prefer to have treatment in cancer care close to their home, where they can have dinner with their family, where they can sleep in the same bed as their spouse. And that way it gives you an opportunity to address the treatment plan, to look to see if there's any discordance and manage some of that.
Yeah, and I think that part of it is also that there are times when you actually need a second opinion, when they need to go somewhere else. And so
Sure.
I had a patient with a malignant metastatic pheochromocytoma, of which there are 100 or 200 a year in the country. And there was one trial of a new drug that was only at 2 centers in the country. And I tried to get them the second opinion, and their insurance company wouldn't let them be seen. And then I spent a month battling to get them the second opinion. So I think that there are times when it's actually wrong not to send them to those
Of
organizations
course.
as well. And I think it's balancing that.
Yeah, so I too have seen utility in facilitating second opinions for many of my patients. Frequently, if they have intractable cancers where I don't have a good clinical trial fit for them, and I know nationally somewhere else that they do have a clinical trial fit, getting them to those right places can be really helpful. Fortunate to have great clinical trials at my center, but we don't have everything. And so frequently that can be helpful to patients. But I think if doctors approach this transparently with their patients, encourage them to do what is going to make them feel comfortable, and have open and honest discussion with them, they can navigate the environment better. I find myself, actually, I often manage that referral. So patients tell me who they'd like to see, and I make sure they get all the appropriate information. It makes that second opinion process much better for them.
I completely agree.
Thank you for your time today, Dr. Hirsch.
Thank you for having me.
Thank you for watching us today.